Welcome to Integrative Medicine Perspective. I'm Dr. Wendy Liu. Today, I would like to share some of my observations, thoughts, and reasoning about high protein shakes as meal replacement strategies, especially those commercially available high protein shakes. These are very common in our life. Many people use them as sports drinks to help increase muscle formation. Some use them to precisely control calorie intake to help with weight loss. It is not uncommon for cancer patients to use high protein shakes as meal replacement to supplement their nutrition. Some even depend on those protein shakes at 100% level, especially those people with swallowing difficulties. Many of those protein shakes are recommended by patients, dietitians, and nutritionists. Indeed, these nutritional shakes are clearly labeled with calorie and protein content, vitamin and mineral content, and so they are very easy for the dietitians or nutritionists to perform a weight-based calculation of the exact amount a patient will need on a daily basis. They are also very easy for the patients to use because they don't require any cooking and patients have choices of different flavors. So are these nutritional shakes all good? Do they have any flaws? So I would hope to use an example today to show some of the flaws of these nutritional shakes. Let's say we have a 70-kilogram patient who is undergoing radiation therapy to the head and neck region. And during the therapy, the patient develops a sore throat and swallowing difficulties. So his nutritionist or dietitian recommends him to start with 5 cans of these particular high calorie, high protein shakes. And for the example brand I'm using today, I put a link to its official website below. Now let's take a look at of the tables here. These tables provide information on nutritional contents of 1/8 ounce can. So we can see 5 cans altogether provide 1,750 kilocalories and 80 grams of protein intake, which are appropriate for a 70 kilogram person. When we look at the vitamin side, 5 cans altogether will provide adequate amount of vitamin intakes. So what could be the flaws of these protein shakes? The number one important, my opinion, and could be serious flaw is low sodium content. We can see 5 cans altogether provide less than 50% of the daily recommended salt intake. Many people probably would ask, isn't a low salt diet healthy? Well, low salt diet has its specific indications. It is only suitable for people with those indications. It is not for the general population, at least not for the most of us. One of the important reasons for that is most of our body weight, more than 50% of our body weight is water. The force to hold that water in our body, retain that water in our body is salt. The main force to retain extracellular water and the water outside the cells is sodium salt, sodium chloride. When we are on a low salt diet, we are prone to dehydration. So it is very common for me to see in the clinical setting people who try to lose weight with these protein shakes. They have initial significant weight loss just at the beginning 3 to 4 days. Now, given there is weight loss because of decreased calorie, but one major part of it is because of dehydration. I have also observed cancer patients develop symptoms of fatigue and palpitation just days or within a week after switching to these high protein shakes at a 100% level for their nutritional intake. I know they developed dehydration. Now, for these patients, just encourage the patient to drink more water will not solve the problem because you need salt to hold the water. So low sodium content is what I consider the number one flaw of these nutritional shakes. Now, here is an interesting similarity between traditional Chinese medicine theory and our conventional Western medicine theory. In traditional Chinese medicine theory, metal produces water. Now, here we just talk about by conventional Western medicine theory, salt, in this case, the metal sodium holds water. I don't think the similarity is just a coincidence. I hope in the future to be able to share my thoughts on the similarities between traditional Chinese medicine and our conventional Western medicine. Okay, I get a little sidetracked here. So let's get back on the high protein shakes. So the number one flaw we talk about is low sodium content. The second flaw is also a low salt content, and this particular salt is potassium salt. We can see 5 cans together provide just about 50% of the daily recommended potassium intake. Now, potassium is an important intracellular, inside the cell electrolyte. It is important to maintain cross-cell membrane electrochemical gradient. This particular electrochemical gradient is important for the normal cell physiology. For example, our heartbeat, the heart muscle contraction, our skeletal muscle contraction depends on the normal electrochemical gradient. When potassium deficiency occurs, people can have symptoms of muscle weakness, constipation, palpitation. When potassium deficiency is severe, people can have fatal arrhythmia or even encephalopathy. So I think the second important flaw is low potassium content. Now, the third flaw is low fiber content. We can see 5 cans together provide only 20%, 1/5 of the daily recommended fiber intake. Fiber is an important food to the gut microbiota, the gut bacterial community. By regulating the gut bacterial community, fiber regulates our metabolism, immunity, our sleep, and even our emotions. So to say that fiber is an essential nutrient to our body, it's definitely not an exaggeration of its function. So the third flaw is low fiber content. Now, with these 3 flaws, I don't think these protein shakes are suitable as meal replacement, especially at high level, let's say 100% level. So when I have patients in this type of situation, I mean, the 100% depend on commercially available protein shakes for their nutrition. I usually would modify their diet to, when possible, to change their diet to 100% real food and teach them to use real food to make liquid meals to help achieve a complete and balanced nutrition. If it's not possible, at least supplement some real food to compensate for those deficiencies. As for whether the nutrition in these protein shakes is complete, I would refer you to one of the video I made previously about the completeness of multivitamin. I will put a link to that video below. That's all for today's discussion about high protein shakes as meal replacement strategy. I hope to see your comments and questions, and I will see you soon.